I'm Robert McMullen. I'm a psychiatrist. I went to undergrad at Washington and Lee University and medical school at Georgetown in Washington, which was a great medical school. And then I did my residency in psychiatry at Columbia University. And I've been practicing mainly psychopharmacology for well over 30 years, and in 2010 I added TMS transcranial magnetic stimulation, and I have 2 different types of machines for that. But what I want to talk about today is what's now called persistent depressive disorder, PDD, which basically means a chronic mild depression. It used to be called a depressive personality, and that's really an unfair name because there's really a biological basis to it, or else medications wouldn't help it so well. And Robert Spitzer, who unfortunately died just a few years ago of Alzheimer's, renamed it Dysthymia, which dysthymia basically means feeling abnormal, not feeling good, and or an abnormal mood. And then recently it was changed to persistent depressive disorder, or PDD. Now, generally, these are people who have chronic mild depression, are generally unhappy most all of the time, and they have depressive symptoms. They have decreased enjoyment, their sleep might be off, their concentration is not 100%, it's hard for them to get enthused for things, they may sleep a little too long, or they may have some awakening in the middle of the night. Generally, symptoms like one has in a major depression, although much milder, and sometimes the symptoms are minimal, and it's just mainly the chronic depressed mood and chronic negativity and chronic unhappiness. I think the first move people should make with something like this is go to a therapist, but always keep it in mind that eventually you may have to go find some medication that will work. But a cognitive behavioral therapist is often the best, somebody who will work on changing the way you view things and reframing things instead of thinking about each thing in your life as a negative, to argue with yourself a little bit and reframe it into something positive, or even just argue with yourself that we're like a prosecutor when we're depressed. We come up with all these negative things about ourselves, and then we don't give a defense. So it's like if you had a trial and the prosecutor gets up and makes his case, and then the defense lawyer gets up and says, well, I don't have anything to say. So we convict ourselves. There's also some important behavioral things that anybody that's unhappy or depressed, and even people with big depressions, if they can force themselves to do things, will help. And a major thing is to stop being lonely. And somebody who's single and lives alone and isn't seeing friends, or even somebody who's married but they really don't have much relationship with their spouse, needs to do something where they're getting out and seeing friends. And if they don't have friends, they should start to make some. And to just do more activity, more exercise really helps. If you just go running or lifting weights, even by yourself, that's going to lift your depression somewhat. When I was a bit depressed a while back, I maybe went overboard in the things I did, but I would play tennis in the morning, at least a good hour and a half, and get all worn out. And then I would go play 9 holes of golf, then after that, I would go bowling. And I just started bowling a year or so ago, and have been taking lessons from the manager at the bowling alley. And so in these places, even though I didn't make a lot of friends, close friends where we did things together, I made acquaintances and I got to know people better and better. And even going into the bowling alley, the people who work there and the people at the front desk all know me and know my first name, and will make some accommodations for me and make sure I get the best alley and so on. And it's just a good feeling. But also to keep in contact with friends and maybe just call them up. A friend of mine was separated from his wife, and he was actually a psychiatrist that was really good at family therapy. And he started calling me up every week, and he said that this is the way I have to keep myself out of depression, is I've got a list of all my friends, and I call each one of them up every week to talk. And it helped them a lot. Now, don't go to therapy forever if it's not beginning to help significantly with the mood, or it's not helping 100%. There's an interesting story, I think, historically about this, and that's a lot of people with this mild depression didn't come in to see us or see me in the past until starting about 1988. And around that time, someone named Kramer wrote a book called Listening to Prozac. What happened with Prozac is more and more people began to take it, and a lot of these people had very mild depression. They had this persistent depressive disorder. And some of them were newspaper people or magazine people. And then they would go to their editor and say, you know, there's this new medicine I want to write about, and write about the depression and so on. He or she didn't tell the editor that they were taking it. So the knowledge about the Prozac had legs, and more people found out about it, and more people came in. And another thing that happened with Prozac was it was the first medication that we had that had extremely little side effects if you treated most depressions, especially mild depressions. The old medicines were terrible. The tricyclics like Elavil and tofranil, imipramine, and so on, that they gave you a dry mouth, they sometimes affected your concentration, and they did a number of things besides just help the depression. They hit 5 different receptors, and only 2 of them helped depression, and the other 3 caused side effects. And with Prozac, fluoxetine, and most of the subsequent antidepressants, they just affect 1 receptor, and some of them affect 2, but there are 2 that both help depression. So if it didn't have many side effects, and your depression was relatively mild, then when people went to a college reunion and somebody said, you know, there's something very different about you. Did you get a facelift or you cut your hair? There's something so different. I said, no, I got an antidepressant. I'm not constantly glum and mildly depressed all the time. People would talk about it. And so more of the word got around, and suddenly I was having all these people with mild depressions come in and get on Prozac, which worked quite well. Maybe 50% of people would do really well with practically no side effects, especially if the dose didn't have to go too high. And maybe 50% of people would have some side effects, but maybe only 25 any significant. And one other thing that happens with this dysthymia or pervasive depressive disorder is that they sometimes cycle. So sometimes cycling every once in a while, every year, every few months, into a worse depression that's like a major depression, and then we call that double depression. And those people should seek medication help a little more quickly, because the major depressions might not respond to the psychotherapy, but sometimes they do. I only see the ones who didn't respond and were sent to me. So the people that totally responded to psychotherapy, I never see them. So I don't know how many exist. Anyway, that's my little summary on mild depressions and sometimes the double depression where people cycle between mildly depressed and major depression.
Thank you, Doctor.